Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we are announcing 24 new cases of COVID-19, taking our total to 127. The total number of deaths related to COVID-19 remains at 1. As of this morning, 4 individuals are hospitalized. 3 of those are in intensive care. Our data indicates 4 individuals are listed as recovered. Public health investigations are continuing, and further details and information will be provided on our website as it becomes available. On Monday, 1,130 tests were completed at CADM Provincial Lab, bringing the total tests done to date to 10,044. There have been cases identified in healthcare workers at St. Boniface Hospital and at Grace General Hospital. Public health investigations are continuing, and any close contacts will be contacted directly by public health. Any details about other cases will be provided if there is public health reason to do so. I can confirm that public health officials are seeing early signs of community transmission in Winnipeg. Public health investigations have not been able to confirm if several cases have had any connection to travel or to other confirmed cases. We knew to expect this as more and more cases are introduced into a jurisdiction. Community transmission is going to be inevitable. This is the point in time where we would begin to initiate our social distancing strategies, but we have been ahead of this and have had many of these strategies in place at present, and we're going to continue to enhance those strategies over time. We've made clarifications to the public health order issued on March 30th to ensure businesses that do not provide critical services understand that they are able to operate during the state of emergency. Those non-exempt businesses may continue to operate where customers can order goods online or by telephone. Customers cannot attend a business premises or property to order goods. Those companies can continue to sell goods to customers where those goods can be picked up at the curbside or delivered to customers. Customers cannot pick up goods at the business premises or on its property. Staff are allowed to attend business premises without limitation on the number of staff, as long as they take appropriate measures to ensure social distancing of the 1 to 2 meters occurs. Businesses can accept delivery of goods and may allow services such as construction, repair, maintenance, and cleaning to occur on their premises and on their property. Examples may include a garden supply center may allow staff to enter the premises or property to prepare bedding plants. The center may sell plants online or by telephone, but can only allow customers to pick up plants at the curbside. Hairstylists may allow staff to attend premises to prepare products for sale. They can sell products online or by telephone, but must not allow customers to pick up product within the business. Golf courses may allow staff on property to prepare for opening, but cannot allow members to play golf or undertake any regular activities at this point. All of these socially distancing strategies are here to flatten the curve, to limit exposure to COVID, to interrupt the transmission of this virus. So these strategies are important to practice continually. Now is the time to stay home. I can't stress that enough. We see this virus being transmitted. We see our numbers increasing over time. We have seen significant and serious outcomes. Now is the time for social distancing. Stay home. If you must go out for essentials, do so alone if you can, and practice social distancing strategies at all times. This is our chance to interrupt the transmission of this virus, but we rely on all Manitobans to do their part. Stay home if you can. If you go out, practice social distancing, and only go out for necessities. This includes all Manitobans. We hear of cases in certain communities, in certain regions. This should not change your approach. The approach right now for all Manitobans is social distancing. Stay home. If you're aware of a case within your community, stay home. Practice social distancing. If you're not aware of a case within your community, stay home and practice social distancing. Those who have a fever, cough, stuffy nose, sore throat, it's vitally important that you stay home. Do not attend a workplace. Do not go grocery shopping if you're ill. Stay home. If you have any concerns, call Health Links to get the direction on whether testing is required. If you have more severe symptoms, shortness of breath, you may need to seek medical care, and I would encourage you to do so, but call Health Links, call first. I know these are challenging times. Social distancing strategies puts added strains on individuals. These public health orders have put strains on many small businesses. We would not be implementing these strategies if it wasn't an extraordinary time. This virus, we are now seeing community-based transmission. Now is our time to act, to interrupt the spread of this virus. But we can only do so with the help of all Manitobans. We all have that role to play. We are all in it together. Now is the time. Stay home, and stay home. If you must go out, do practice social distancing at every opportunity. Stay 2 meters away from everyone if you're out. Wash your hands. Those who are at increased risk of the severe outcomes of COVID-19, those over age 65, those with underlying medical conditions such as cardiac conditions, respiratory conditions, any medical conditions, especially those with immune compromise, should be staying home. Reduce your risk of being exposed to this virus. Again, we encourage all Manitobans to use credible information in their decision making. Do not repost unfounded rumors. Do not spread rumors. Use credible information. We've heard of cases of people being bullied who are cases or suspected cases. This is not useful. This will not help against this virus. Now is a time for us to work together, to support each other, to reach out, to offer a hand to other Manitobans. We just need to ensure we're maintaining that social distancing, not social isolation, not bullying of others. Working together, we'll be able to decrease the impact of this virus on our communities. Staying home means that includes family get-togethers. We know there's holiday seasons coming where there might be large family gatherings, which are the norm. This is not the time for business as usual, though. Now is the time to stay home. Now is not the time for large family gatherings. Look for other ways, virtual gatherings. Ensure we stay in touch. Ensure we're reaching out to vulnerable populations. But now is not the time for large gatherings. Now is the time to stay home. Even though we see this virus circulating, we see our numbers going up, we are not helpless. We are taking all of these moves. All of these implementation strategies are to reduce the impact of this virus, to interrupt the transmission. So our actions will have that effect, but we all need to work together to do this. And I encourage all Manitobans to take this very seriously. Stay home, practice social distancing, and together we're going to work to flatten the curve of COVID-19. So thank you very much. I'll pass it to Lanette.
Thank you. So I want to start today by letting you know that new screening criteria procedures are being implemented for staff across all areas of Manitoba Health System, starting with those who are working in acute and long-term care facilities. These measures will begin being implemented today and soon be in place in all facilities and services across the province. The staff arriving for the start of their shift will have their temperature taken and be required to answer questions about any symptoms they may be having, their travel history, and their exposure to COVID-19 cases. Staff who are required to come and go during the course of their shift may be rescreened upon entry into the facilities and service areas. This decision follows confirmation of healthcare employees at 3 different sites testing positive for the virus in recent days. We must ensure that we are taking every possible measure to ensure our staff and our patients are protected. Staff must stay home if they are ill, even if their symptoms are mild. We have a duty to protect our patients, our staff, and our community to ensure that we need to take every precaution. The public yesterday was informed about a positive case involving a Selkirk Regional Health Centre staff member. And as Dr. Roussin noted, there are now cases involving employees both at the Grace Hospital and St. Boniface Hospital. No patients have been identified in either cases as being in close contact with the individuals. However, numerous staff contacts have been identified. So both investigations at St. Boniface and at Grace Hospital are ongoing. Upon learning of the results in both these instances, all staff who were identified as close contacts while the individual was symptomatic, they have been sent home to self-isolate for 14 days. Both hospitals where these individuals work have been thoroughly cleaned, and normal service delivery now continues. It is clear, however, that these exposures have had a significant impact on our staff, of course, as well as the operations in providing service delivery. So we are working with both sites to ensure that they will be able to be staffed appropriately, and we are investigating any other steps that may be required to ensure that staff are appropriately protected. This news, of course, is very upsetting to us, and our thoughts are with the staff members who tested positive, as well as all of their colleagues at the respective sites. We also know this news will be distressing for the public, and our investigations have not identified, I just want to repeat, not identified any patients at the site as being in close contact with these most recent individuals. These cases, though, should serve as a cautionary tale for all Manitobans, including healthcare workers, as we all have a duty to protect ourselves and our community. So more than ever, that duty does include staying at home if you're sick, even if the symptoms are mild. So we will succeed in flattening this curve, but we do all have to heed that message. The other thing I wanted to speak about, which we've been talking in the last couple of days, is part of our planning for COVID-19. We have been preparing for a time where we need to support people and help provide spaces for people who can't properly self-isolate at home. So we are looking at other spaces outside of people's regular dwellings, and because we know that the ideal location for the vast majority of people for COVID-19 is to recover at home, there are people who don't have a home or whose homes they cohabitate with people who have chronic diseases. Or it may be just very difficult to self-isolate and minimize the risk to loved ones. So we're also looking at the need for healthcare workers who may need to limit the risk to their families. So a request for proposals has been issued by the Manitoba government to help us with this task, and it closes tomorrow afternoon. We anticipate that hotels and inns and motels will step up and offer their services, but we are open to all possibilities. For now, only urgent situations for COVID positive patients or healthcare providers will be considered for staying at these locations, but we will definitely, as we have been planning to escalate and expand criteria so that as this pandemic grows and the numbers grow, that people have a safe place to live. I also just want to highlight a memo came out from our incident command highlighting that care for patients in Nunavut as well as Northwestern Ontario will be accepted and cared for within the Manitoba hospitals. For the purposes of infection prevention and control, these patients and their escorts who normally reside in Nunavut or Northwestern Ontario will be considered Manitobans and subject to the same screening and precautions as other patients in our province. Just a quick rundown on the stats. So our online assessment tool garnered about 7,000 web views yesterday, and since launching more than 2 weeks ago, the English and French versions have had 365,000 web views. Dynacare is also still plugging away at the backlog of phone calls, and they yesterday made 1,200 calls to patients to let them know about negative results. As a reminder, those of you who have positive results will be contacted immediately by public health. And we hope to have HealthLinks data for you tomorrow or Friday. And we will also have an update tomorrow for you on the new community testing site at MPI's Main Street Service Center. And one more thing just before we turn it over to questions. We know a lot of parents out there are getting questions from their young children about COVID-19. And it's an unsettling time for all of us, kids and adults alike. Tomorrow morning, we have Ace Burpee and Dr. William Lee, who's a pediatrician in Manitoba, and they'll be talking with kids about the changes that are happening right now and answer any of their questions. So people can watch along on the Manitoba government's YouTube channel starting at 11 a.m. So please tune into that. And if you have any questions, please feel free to send those questions to covidquestions@sharedhealthmb.ca. And with that, we can open the line to questions.
A reminder to reporters on the line that you will have a primary question and a follow-up question. And please reintroduce yourself before you ask your questions. From CBC Manitoba, Bart.
Good morning, Bart McKeever, CBC Manitoba. Dr. Roussin, when we're looking at the data online, what do you make of the distribution of cases, specifically all the young women aged in the 20-something decile?
That's right. So that would make up the highest proportion of positive tests right now. I don't think there's much we can make of that right now. There's lots of reasons why that might be. For some reason, that might indicate much more testing being done in those in that age group. But I don't think it's really the focus right now. What we focus on is those at highest risk of severe outcomes. And so we'll continue to monitor these trends and then report if we notice anything significant.
Okay, and a follow-up question from Mr. Siragusa. While the painter was speaking, the Newfoundland issued an urgent plea saying that they are running out of time with money and they're not getting their protective equipment. What is the status of the protective equipment here? Is Manitoba getting it on time? Is there a similar degree of urgency, and if not, what's the situation?
Well, from what I understand in speaking with our logistics team, that we do have enough supply for several weeks, maybe months for some, depending on the supply. And there are orders that are expected to come in. They have been coming in so far. If there is any change to that, we will for sure be transparent and let people know that. But at this point in time, I have not heard any abruption or stoppage of the orders. We continue also to work with the provincial and federal people because it is a big order for all of Canada, and so those conversations are happening.
Thanks.
From the City News, Mark.
Hi there, Mark Neufeld, City News. The new screening procedures, doing temperature tests and then asking questions for staff entering. If we thought that this was coming, why do it now? Why not have started this weeks ago?
Well, the staff who have been COVID positive have been at work and not feeling well, and we need them to stay home. And so that is one objective way where we are able to identify if they are sick or if a temperature comes before maybe the sniffles or a cough, that maybe we can catch things earlier. And if they show up to work, we can send them home if their temperature is up. So it's really prevention, and we know staff are doing the best job they can, and they work as teams, and they don't want to let their teams down. And but if you're not feeling good, you shouldn't be at work. And if we can catch that with your temperature before you catch that with other symptoms, we're gonna do everything in our power to do that. So the question is, why didn't we do it before? Well, there wasn't community spread before, I guess. Most of them were related to travel, and people were self-isolating. So as things evolve and change, we're going to adapt our plan.
Now that we're sort of talking about it being community-based, what other plans might we see changing in coming days, or how does this change? I mean, I know we're still messaging for people to stay at home and have distance between them, but how is that messaging maybe going to change in the community?
Yeah, well, so certainly this would normally be, getting to that trigger for these social distancing strategies. So we've already had them in place. So this early community-based transmission may not immediately change a lot of what we do, because we've already had a number of the factors in place. But the staff screening certainly is that. We're looking at different methods of using personal protective equipment as well within facilities. So a lot of the changes that normally would have been triggered by this, we've already had in place.
From the Winnipeg Free Press, Larry.
Larry Kush at the Winnipeg Free Press. Dr. Roussin, could you say how many hospital workers have tested positive in Manitoba for COVID, and how many others may be self-isolating as a result?
Yeah, so I definitely don't have a total number on how many might be self-isolating right now. Some of these investigations are ongoing. The total number of healthcare workers, I don't have that number. I know that we are going to be trying to find a way to be able to report that better, especially if we are able to report whether there's a strong indication that an individual acquired it at work. So we're working on ways to be able to report that.
A follow-up on another topic. Why did public health authorities wait until last night to post a bit of information on the website about Club Regent Casino? Apparently, a customer who had tested positive was there March 16th, but yet we had no inkling of that until March 31st. Can you tell me why that occurred?
Yeah, I know that the report of that did come to public health right around the time when we reported it. And looking back, it was felt that the actual exposure at Club Regent was very low risk. So it wasn't really something that was considered that needed to be widespread. But since we've now have that area on our web page with various events, we posted it there as soon as we heard about it centrally at Public Health. But the actual risk to anyone at Club Regent at that time was low.
Just to clarify, when did Public Health learn about this?
Yeah, like public health at Manitoba Health Surveillance, I believe we got that report on the night before we posted it.
On the 30th.
When was it? I think it was posted on the 29th, I believe. 29th, I believe. So it was the day before that is when we received it at centrally at Public Health.
Thank you.
From CJOB, Diana.
Good afternoon. It's Diana from 680 CJOB. Dr. Roussin, we've clarified the rules for non-essential businesses and their ability to operate with online sales and curbside pickup, that sort of thing. What would enforcement look like if a non-essential business isn't closed as mandated?
Right. So this would be initially under the mandate of the public health inspectors, and they would approach that business owner, advise them of their requirement to comply. Most times that's effective. Very high rates of compliance, period, and then even higher rates when just approached by a public health inspector to ensure they're comprehending the order and what they should do to comply. Barring that, then there are further orders and penalties under the Public Health Act that could be in place.
And just as a follow-up, what is the plan for pharmacists in Manitoba? Will they at any point be issued personal protective equipment, or is that kind of not in the plans at the time being?
That's not right in the plans right now. So again, this is spread by close, prolonged contact. So being, across a counter from someone is fairly low risk. And so we'll look at all of these things as things develop. But, close, prolonged contact is how this is spread. And so only people who are within that close space assessing clients are required to wear personal protective equipment.
From Global News, Marnie.
It's Marnie Blunt from Global News. Dr. Roussin, now that we're seeing early signs of community transmission and we have confirmed cases with healthcare workers and then the case of the casino, how will this impact testing? We are screening healthcare workers now, as was announced today, but how will this impact testing for members of the public? Are we going to be seeing more widespread testing, or at what point would we see something like that?
Yeah, so that's those plans are certainly in the works to deal with the capacity and who we're going to be testing. So certainly within the hospitals and healthcare workers, we're testing now. You can see that the CADM lab ran over 1,000 tests yesterday, and so that's not just going to be returning travelers, and so we're seeing testing is spread. We're still focusing on returning travelers who are symptomatic, healthcare workers who are symptomatic, or those congregate settings or First Nation communities, but again, only symptomatic people. But as time goes on, we might open it up to all symptomatic people. But really, at this point, the social distancing strategies are vital. But what's also vital there is stay home if you're sick. So again, if we're not testing everyone, but somebody stays home when they're sick, then we've accomplished the same thing. They're not going to be spreading that virus or whatever virus they may have. So really important messaging. Even mild symptoms, stay home if you're sick. With or without the test, we're dramatically reducing the transmission of a virus.
And the next question is, we also asked the Premier about this. We do a video of some people who appear to be selling gear, personal protective equipment like face masks. What's your response to that, or your message to people who are trying to profit off things such as this?
Yeah, my message is we're in a pandemic. And if we as Manitobans want to get through this, we're going to need to be working together. We're going to need to be following credible advice and searching for credible information. And we're going to need to protect our healthcare workers. And so our healthcare workers are vital to our response. Our personal protective equipment needs to be in the place that it is most important, and that's in the hands of healthcare workers. So there's really no use for the general public to be using masks, and those masks are much better utilized by healthcare workers. So I would encourage everyone to start knowing your role with this pandemic. Everyone has that role. Everyone can play a big role, and that's to stay home, practice social distancing, protect our healthcare workers.
Thank you.
From the Brandon Sun, Aaron.
Hi, this is Aaron with the Brandon Sun. As I'm sure you're aware, Fremont House is a pretty large area, and Western residents are quite concerned as the number of cases are rising, and especially now with early signs of community-based transmission. So I was wondering, can you or will you be providing a more specific breakdown of cases, even if it's just, saying what's in Brandon versus surrounding communities?
Mm-hmm. Yeah, well, I would encourage everyone there to again, listen to the credible information on this virus. So that information should not be of any benefit to anyone, right? If you have a known case right in your community, you should stay home and practice social distancing. If you don't have a reported case in your community, you should stay home and practice social distancing. So I'd encourage people that type of information should not change your behavior right now. Now is a time for all Manitobans to stay home, practice social distancing, and knowing that there's a case that might be in your community or a community next to you shouldn't change your actions. So all Manitobans, now is a time for action. Stay home, practice social distancing.
Thank you. And this is a follow-up. Will these new screening measures, are they also going to be put in place for staff in personal care homes or visitors just a few visitors who are allowed into hospitals at this time?
Yes, we're going to have to be looking at that. So our goal is all facilities for sure, and we're going to have to figure out a plan for community healthcare workers as well. But we're starting with the facility base, so acute care and long-term care would be included in the coming days for screening.
Thank you.
From the Winnipeg Sun, Scott.
It's Scott Billick here from Winnipeg. I can appreciate that, this is changing every day and then community transmission system now, but I'm still looking for kind of a clear answer to why healthcare workers in the city and across the province and facilities where acute care and all sorts of different types of care is done, why they weren't screened right from the beginning. Because obviously this is happening now, but why wasn't this done earlier to stop what we're now seeing in hospitals?
So, well, I mean, there was, right from the beginning, there was a lot of policies put in place, a lot of messaging, a lot of education to deal with this. And so certainly at that time, we thought that with all the healthcare workers knowing how important this is, with the education, with the policies in place to prevent this, we were expecting that, just that. When we see these other cases, now we see that, a lot of times these are very mild symptoms, and people go get tested, they test positive, and then realize, actually, it was, I think, the day before maybe those mild symptoms started. I didn't really notice it. So there's a lot of things that weren't predicted. But we just now are going to respond when we saw a couple occasions like this. But right from the beginning, we knew how important it was to not have ill healthcare workers at work. And so there was a lot of policies, a lot of procedures in place to prevent that. And then so we see now there's been, so I mean, this has been going on for a while, and there's lots and lots of healthcare workers. So these are just a few very rare examples of what's happened. But we'll respond and try to make sure it doesn't happen again.
And just a follow-up, at what point now with community transmission, even in the earliest signs of it, are you guys I guess, looking at a lockdown, whether it's a citywide, province-wide, that sort of thing?
Well, I mean, it depends on how, how we frame that. I think that we've been messaging, along those lines for weeks now, right? I mean, it's stay home. Now is time to stay home. Practice social distancing. Only leave your house for essential reasons, and do so alone if you can. Practice social distancing at all times. We've limited a lot of non-essential businesses from operating. And so we have a lot of things in place right now that should result in the flattening of this curve, in the interruption of the transmission. So we can always are reviewing our strategies, and have you seen we've enhanced them over time, and so we may still do that. But we've just today, in putting into effect these enhanced social distancing strategies, and we're going to see how things transpire from there.
Thank you. From Canadian Press, Steve.
Well, hi, Dr. Roussin. Steve Lambert from the Canadian Press. You mentioned that now that we have confirmed the three healthcare workers. I know you mentioned the one yesterday was a direct result of travel. Is there any indication yet to the two other cases whether it was community transmission or travel, or even whether they perhaps caught this in the workplace?
Yeah, so these ones are currently under investigation. So we're still going to look to see if there are, is there evidence where it was acquired. So we'll be able to have more information on that as the investigation goes on. And, I think that healthcare workers who it's likely that they've acquired it in the workplace, that's going to be something that we're going to try to be able to articulate if we see that.
Okay, and as a follow-up, you're starting to see early signs of community transmission in Winnipeg. What are those signs, and were the two healthcare workers in Winnipeg among those signs?
Well, these ones here are still under investigation. So we've seen a number of cases, 4 or 5 cases that we can't link to travel or to a known transmission chain. And so these are some of these what we would call pop-up cases where we can't link to a transmission chain. It's also evidence that even though we have these testing strategies going on, we are testing people in the community that don't actually meet it, or we wouldn't have been able to find these cases. So, but that's what we're seeing now. So people without a known transmission chain or recent travel, we found are positive. So that would give us that hint that we're starting to see some community-based transmission.
Thank you.
From CTV, Michelle.
Just a follow-up to that, Dr. Roussin, how were these ones found then? Were they from tests inside the hospital, or can you explain that?
So I can't speak to where these were tested, but it's kind of like I was alluding to there. So when you're running 1,000 tests in a day, it's very unlikely that that's 1,000 symptomatic recently returned travelers, right? So although that's our testing criteria, we knew all along that we're reaching other groups, and here's examples right now that's coming up. So we're not changing our testing criteria now, but there's a lot of testing getting done, and so some of them are going to be falling outside of our defined criteria.
Okay, and just a question on another matter. How concerned are you about the virus being shared into long-term care facilities for people like home care providers? And should they be wearing masks, those people, or will those people be screened?
Is that mine or? Oh, okay. So we're talking about the home care providers on whether they should be screened?
Or, yeah, whether they should be screened wearing masks when they're going into a place like a long-term care facility.
Oh, so for long-term care facilities, they are going to be included in our approach of screening healthcare providers. We're looking at different strategies for personal protective equipment in all facilities as well. So we know long-term care facilities has a number of risk factors there to people who could develop severe symptoms of COVID. So we'll take all precautions there.
But currently, Michelle, they do screen before they go in the home or as they come in the home. They do have access to personal protective equipment. And but as we evolve and adapt how we're screening staff, and then we will make sure we include the home care people as well.
All right, we have time for one more round of questions, but we'll just take one question, no follow-up on this round. Back to Bart at CBC Manitoba.
CBC Manitoba, Bart McKee this year. Dr. Roussin, Ontario just released today an open data portal, full age, gender, health status, travel indicators, health region for each of their known cases. When will Manitoba follow suit?
Yeah, I think we're getting our numbers are starting to increase, and so we'll continue to update the our website, and I think that is a goal that we can start to provide a bit more detailed information as the numbers increase. It's much less likely to be able to identify any individuals as the numbers increase. So we're looking to be able to function in that transparent manner so people can see the nature of the cases.
And I know you said one question, but briefly, Ms. Siragusa, all workers going to hospital screened or just healthcare providers? Like our maintenance workers, delivery people, cafeteria? Is everyone going into hospital getting screened?
Healthcare workers who are in direct patient contact will for sure be screened.
And everyone else?
From City News, Mark.
Mark Neufeld, City News. Just on the heels of sort of the announcement, we're looking for retired nurses or returning nurses to enter the workforce. If there is a large surge of people joining the front line and fighting against COVID, will we have enough protective equipment to offer everybody if there's a huge spike in people joining hospital workers?
Well, it depends where those that workforce would be deployed. So we've talked previously about there's many different priorities right now in this pandemic. So it might be working in health links. There's a lot, as these numbers grow, the public health office needs a lot of support. So there's not so much equipment there, like there is digital health, kind of computers and laptops. But for that, yes, we would make sure there were enough supplies. And for the hospital, we have been planning for many months for this event, and there is equipment, supplies, and space available to us.
From the Free Press, Larry.
Larry, Winnipeg Free Press. Dr. Roussin, I'm wondering, with the health workers in Winnipeg who have been tested positive, are these primarily ER workers, and are ER workers needing greater protection given if they are in fact the most vulnerable health workers?
Well, I think that certainly those at the front line are going to be most likely to be exposed to undiagnosed cases. I think that makes sense. So certainly right from the beginning, the protocols and processes are in place for that. We've now are looking at enhanced ways to address things like the screening of healthcare workers. We're looking at other personal protective equipment procedures to address that. But I think it's most likely that anyone with the primary contact with clients is most likely to be exposed to an undiagnosed client.
And I would also say emergency certainly is one area, but there's lots of areas that have direct patient contact that we would be concerned about, including paramedics and home care and anyone who has direct patient contact.
CJOB, Diana.
Diana from 680 CJOB. Just a quick question. I noticed Justice is seeing some changes as a result of COVID-19 with new inmates being isolated for 14 days as well. Has there been a case of an inmate testing positive for COVID-19 in Manitoba, and what are kind of the implications on correctional centers for this? Obviously, I don't know how big of a toll this is going to take if every new inmate has to be isolated for 2 weeks.
So I'm not aware of any positive case from a correctional facility here. Certainly, this is a bit in response to seeing the increasing amount of cases, seeing some of that early community-based transmission. So they're going to take those extra steps. I can't speak towards the the capacity they have and the actual procedures they put in place to do that. But it's just another move forward in the systematic approach to this to the virus. That now, as we're transitioning to community-based transmission, certain changes need to be made.
From Global News, Marnie.
It's Marnie from Global again. We're getting some questions from viewers about, social distancing in public places. People saying they're seeing a lot of people crowded in Assiniboine Park, for example. We've seen, high school students or young people still getting together and playing football. Would the province look at monitoring any parks or anything like this, or will we see any steps like that taken in the future?
Yeah, I think as this order is taking effect, and we'll be looking at public group sizes, certainly they're limited to 10. We want everyone to be practicing this social distancing. And it's really about getting that message out there. And, that these actions, staying home when you can, going out only when it's necessary, practicing social distancing, it really comes down to, it's a chance to potentially save a life. We see this virus being transmitted, and the best way to interrupt that transmission is to stay home. And if we all, chip in, we all work together and do this, we can significantly affect the transmission of this virus. So that's the message, is that by doing your part, you're saving lives in Manitoba. And so I'd encourage all Manitobans to take that seriously, do your part, stay home, and practice social distancing at all times.
From the Brandon Sun, Aaron.
Hi, Aaron with the Brandon Sun again. I'm sorry if this has already been addressed, but have there been any residents or employees of personal care homes or long-term facilities in Manitoba who have tested positive or are under any sort of investigation?
We don't have any residents who've tested positive right now. We have many investigations going on a number of cases, and so certainly an outbreak or a case involving a personal care home client, that's something that we'll be discussing if we become aware of that. But right now, I'm not aware of any residents at a personal care home right now.
Thank you.
From the Winnipeg Sun, Scott.
Yeah, Scott Bullock here again with Winnipeg Sun. Just looking at the Engage Manitoba site where it talks about the new public health orders issued last week there. There's 45 pages worth of questions on the Q&A. Is there any plans to kind of maybe streamline it better for folks who are just unsure of what businesses or whatever? I know the public health order has a lot of legal jargon and stuff like that. Is there any hope of changing that or giving a list to people where it would be more easily digestible?
Yeah, well, it's difficult, when we're dealing with many different businesses and industries. When you're writing an order, it has to be written and we will see that cases will be introduced into the jurisdiction. And you'll see that over time, and we'll see the quite a variability of days where we see no cases and then a few and then sometimes a lot back down to a few. But as you start seeing that community-based transmission, certainly if we don't put in measures to interrupt that transmission, that's when you start seeing the climb towards the peak occur. And so that's what this is all about, is to flatten that climb and lower that peak. And so, yes, as we get to this stage, we're likely to see more and more cases daily, but we're doing all these things to really limit that climb.
And as a follow-up, Public Health Agency of Canada, federal officials, and people in other countries have said you can expect a 30% infection rate. So should we be surprised if we see 100,000, 200,000 people come down with this, mostly with mild symptoms?
That's right, and so I mean the vast majority of cases, about 80%, are mild cases and expected to recover at home. We see different models around, and so you certainly see attack rates being listed in some models as high as 30%. So we're preparing for scenarios such as that. But again, I reiterate, we're not just helpless and dealing with a certain number that we're going to get at. These social distancing strategies are to adjust those numbers. And so we're doing our own modeling numbers, and we'll hope to get some of those out to Manitobans just to give an idea. But they're all estimates. They're not carved in stone. We can do things that can change those estimated numbers, and that's what we're working on now.
Thank you.
From CTV, Michelle.
Hi, Michelle from CTV. I'm wondering about enforcement. We have been told that someone reported a store to public health inspectors, and they were basically told back, like, call the store yourself. This isn't in our scope yet. So really, who is enforcing it, and what can people do now until there is something in place? And one is looking for something to.
Yeah, so I can't speak on that specific incident, but it is certainly in the scope of public health inspectors if a store was operating outside of the orders. And so certainly there has to be some sort of a triage of complaints. There's a number of different complaints that come in, taking various urgency. But it certainly is in there. But these measures have just taken place this morning, so I'm not sure when the call was made. But we do have the public health inspectors, and it certainly is within their scope to visit businesses that are falling outside of the public health orders.
Thank you.